Welcome to Basic Documentation Characteristics.
The healthcare system is overflowing in clinical documentation, both paper and electronic. To put it simply, healthcare documentation is created by any person who documents within the health record. When documentation is accurate and complete, it works wonders at telling a client's story and can even improve their experience. The following shows some of the basic characteristics of good documentation. Not all people are born with wonderful handwriting, but it is important that your handwriting be legible. It's critical to write neatly and legibly. The only consideration for handwriting is its legibility, no matter if you are blessed with straight handwriting or not. Electronic record keeping has helped with this, but you will still encounter times when you need to take handwritten notes.
Be sure you're using the correct client record. Mistaken entries can leave negative impressions, but they do happen. If an error does occur, then your organization should have a policy regarding error correction. The important factors to remember when correcting a documentation error is to be very clear what the error was, and what the correct information should be.
Maintain confidentiality of client health information at all times, including passwords or information required to access the client health record. Use a secure method to transmit client health information. This not only includes electronic information but any information transmitted in any form. Understand and adhere to policies, standards and legislation related to confidentiality, privacy and security. These policies are in place for a reason and can help you choose the appropriate way to deal with privacy.
Time is everything in the world of nursing. It gives you the power to control outcomes if you put time as your priority. That's why it is important to document events chronologically and promptly, making it easier for a third party to follow your timeline of care. Avoid gaps if possible. Only document procedures immediately after you have committed them. This may be difficult at times, but chart any findings and procedures close to the time after you do them. If large gaps occur, then follow procedures in place to document them. Timelines are especially important when a medical record is examined in a malpractice or negligence case. Date and time are critical in establishing a timely response to a patient need.
Be accurate, relevant, and consistent. Correct spelling establishes competence and attention to detail. Misspelled words or illegible entries can result in misinterpretation of information. It also leads to an undesirable impression that can affect your credibility during judicial proceedings. Abbreviations are commonly used among healthcare workers as a time-saving methodology. Unfortunately, abbreviation use can be linked to increased inaccuracies. Abbreviations and symbols that are obscure, obsolete, poorly defined or have multiple meanings can lead to errors, cause confusion, and waste time. Your employer should provide you with a list of acceptable abbreviations for use in documentation. There should be no blank or white space in documents, as this space presents an opportunity for others to add information unbeknownst to the original author. Some important takeaways from this video are: legibility is one of the most common issues in documentation. Be sure you're using the correct client record. Exercise confidentiality at all times. Timeliness is important. Be as accurate, relevant, and consistent as possible.